It was actually way cooler than I expected it to be.
Wow, this is very intuitive.
That was cool. Oh, I did it!
Unbelievable.
That was really fun, and that was a lot easier than I thought it would be.
Welcome to Upward with Transfr, where we tackle the challenges of our evolving workforce and how educators, governments, and industries are changing to keep up. We're dedicated to building effective pathways for workers and job seekers to get the skills they need to enter well-paying careers in high-growth industries. We do that by designing and distributing hands-on simulations that learners can use to explore new career options and develop core skills before entering an in-person vocational training program. Transfr simulations augment human educators, broadening their range of classroom possibilities without costly facilities build-outs or expensive equipment. I'm Jack Sislak, Editorial Director at Transfr, and your host for this episode. I'm joined by Lori Hardie, Nurse and Director of Health Sciences here at Transfr, Sydney Beaumont, Senior Experience Designer here at Transfr, another Lori, Nursing Director Lori Yates-Hodges, and another Sydney, Registered Nurse Cindy Denstorff. We covered a lot on this episode, so be sure to join us for part 2. Okay, we are rocking and rolling. Hey, it's me, Jack Sislak. Thank you again so much for being here. And let's just jump right in and just have everybody go around the circle. And we'll start with Lori Hardie. And just go ahead and introduce yourself, tell the audience your name, your title, and your experience and backgrounds, anything that you think our audience should know about who you are and what you do. So go ahead.
Okay, thank you. So my name is Lori Hardie, and I am the Director of Health Sciences for Transfr. I am a nurse. I've been a nurse for almost 30 years now. And in the last 10 or so years, I have been doing hospital-based clinical education and then focused on simulation-based education. So I'm a certified health simulation educator and have published many times in simulation and contributed to the international standards for simulation, and came to Transfr at the beginning of this year because I was very passionate about the mission, because for myself, education is really what changed my life, and I wanted to make that available to as many people as possible.
Awesome. Let's go to other Lori, please.
Oh, hey, everyone. My name is Lori Yates-Hodges. I am a nursing leader for about 10 years. I've worked at different hospitals, mostly around the Indianapolis area, but also throughout the United States. I am a master's prepared nurse. I was trained in Canada and came to the United States in 2000 as a travel nurse, but then settled into some leadership roles, like I said, about 10 years ago. I currently work in downtown Indianapolis in an administrative role. The hospital that I work at is downtown, an academic center, county owned. It does pride itself on a strong nursing practice, but also has quite a diverse workforce as well. So I really like it here.
No, that sounds great. Thank you so much. We're also lucky enough to have 2 Sydneys on this call. So let's start with our Transfr Sydney, please, and go ahead and tell us who you are and your whole thing here.
Great. Yeah. Hey, everyone. My name is Sydney Beaumont. I'm a Senior Experience Designer at Transfr, leading the module planning for our virtual healthcare clinic, module number 1, patient care foundations. I've been at Transfr for over 2 years now on the instructional design team as well as on the experience design team. My background is in instructional design as well as contemporary commercial art in the US and in Europe. So I come to this work at an intersection between spatial design, adult learning theory, production. What motivates me about this work is the potential for impact that we have, the way that we can scale teaching and reach so many people. So it's a great space to be in.
And then, yes, Sydney, please tell us who you are and how you come to be here.
Hi, I'm Sydney as well. I am a registered nurse. I graduated from nursing school in May of 2022. So I am a couple months into this. I'm a noob, and I've been in labor and delivery. Prior to being a registered nurse, I was a unit secretary, patient care technician, student nurse intern, some of those roles, but the actual registered nurse position is fairly new to me.
Wow, awesome. Yes, we did want somebody who was like fresh to the field so we can talk about like training and all that cool stuff.
Oh, I'm fresh.
Awesome. We're really psyched to have everybody here. So let's start by just addressing the problem. We've continuously heard in the media that the healthcare industry is in crisis and that hiring is a major concern. And so we would love for you to please expand on that, share your thoughts on this. Is it a lack of training facilities? Is it a lack of qualified teachers? Is it the expense of training? Is it the lack of interested students? Take a swing at it, anybody who wants to chat about it.
I can start. Major problem, nursing shortages across the country for a variety of reasons. The pandemic led a lot of nurses away from healthcare. People, the workload, the inability to have a break in 12 hours or 14 hours. The work is really hard, especially when they're working back shifts and weekends and nights and holidays. And people are moving and taking other kind of jobs in nursing. You can work remotely now. There's all kinds of different things available, which kind of hurts us on the inpatient side and bedside nursing. There aren't enough schools. There's not enough training. There's not enough equipment to use. There's not enough simulation labs. There's not enough teachers. People don't want to go and work and teach nursing because the pay is almost half of what you can make in the clinical area. So it's all of those things. So it's a real challenge. And I think that people who are thinking in terms of what we used to do in 2019 or something pre-pandemic is not the same thought that you can use now in a post-pandemic era. So I think that we have people kind of stuck a little bit like, well, this is what we used to do then, but the pandemic has changed all of that. So until we get more innovative and think about how we can decrease orientation times, get people quickly through orientation, training, school, all of that, we're not going to make a dent in any of this. So.
I mean, she hit it on the head. I think the thing to keep in mind is you have to have nurses to create new nurses. You need nurses to train nurses. And the customers that I talk to, the market conversations that I have over and over and over, what you hear is exactly what Lori said, which is we don't have enough clinical faculty. Nationally, we only let in, I think it's 10% of nursing students who are actually qualified because they don't have enough faculty or they don't have enough clinical sites. So clinical sites are, as part of a nurse's education, there's always a portion of that. We all went through it where you are going through as part of your education where you are actually in the hospital or in a clinical site, learning the hands-on skills, doing patient care to a degree that you can legally until you're actually licensed. And there are not enough of those sites, because then it also means that takes up their staff's time. And because in the last 5 years, hospitals have turned over 105% of their staff, 105%. And so those staff nurses are constantly onboarding new staff and don't have time for students. So then it's just this vicious cycle that keeps compounding the problem of not enough nurses. And then the faculty that are there, the average age of those faculty is in their 60s. They're getting ready to retire. The average nurse at the bedside is in their late 40s. So we don't have enough baby nurses like Sydney here. One of the things that we're trying to do with Transfr is to really build career pathways. Healthcare is one of those very unique kind of industries where it's a very prescribed pathway that if you're willing to walk that path, you can go as far as you want to with it. I mean, I started working in the main lab and was making, I think, $4 and something cents an hour 27 years ago. And now I'm in my doctorate, So because of the one good thing about the nursing shortage is if you want to be a nurse, you can get funding for that. And if you work in hospitals, a lot of times they will assist with that tuition.
So how do the simulations that we're developing here at Transfr relate to those challenges that you all just very well set up just a moment ago?
So because the two biggest pain points are lack of clinical faculty and lack of clinical sites. When you have immersive technology where you can actually have hands-on practice that is remote and scalable and portable, that includes an instructor dashboard where you can see how the person actually performed, what this can be as a tool in the toolbox for the current faculty to expand their bandwidth. So now they are actually able to have students in these VR headsets where it's very realistic as a patient environment. That's why healthcare in general has gone to simulation-based education. Most people in healthcare are hands-on learners and really need that hands-on time to practice those skills. And a lot of the skills that we practice in simulation are things that maybe don't occur all the time, but you have to be prepared to manage. And so simulation, including VR, is essential really to training healthcare professionals, both in school and on the job. We continue to do simulation all the way through, annual competencies and onboarding and practicing those very high acuity, high risk types of skills that don't occur all that often. But to your question, it's about if you can't get clinical sites and if you don't have enough faculty, how can you expand those programs to create more nurses? And this is one of the ways that we can assist in doing that.
Awesome. Yeah, great. And to bring Sydney B into this more, I don't know if you can put a little background in here. What made us pick healthcare as an area to expand into? And then maybe the two of you can sort of collaborate on this answer to how did we pick the specific set of skills to focus on for our first round of training sims?
Well, healthcare, the market in healthcare is massive. There's an incredible need there. What VR training and ours in particular provides, it's asynchronous learning, it's repeatable, unlimited practice anywhere anyone needs to be. It means that takes the burden off of that already pressed labor market and essentially means that, those nurses can be purposed elsewhere. People can be practicing. It's standardized. Outside of that, the way that we structure our simulations and between the experience design, the module design, the individual simulation designs, and our incredible team of instructional designers, as well as that we can tailor this training to focus on more nuanced aspects like critical thinking, the different subtleties that build out the skills that make up foundational patient care, standard precautions, infection prevention. VR answers that in the way that we do our VR training.
Yeah, Lori, anything to add in terms of the sort of how we built it kind of aspect of the program?
Yeah, it just made sense to sort of start at the basic patient care skills that are required for many different entry-level roles in healthcare. How we really honed in specifically on what those were is over 100 conversations with healthcare stakeholders, talking to them about where they were struggling, what it was that they needed. And these were the skills that over and over again rose to the top, which makes sense because the turnover is always more in those entry-level roles. And then the folks who are trying to get new jobs are typically going to be starting in that place. And so they need those skills.
Awesome. No, I love that from a transfer storytelling perspective. That just shows how committed we are to finding out what is going to be most useful to people out there. And you had mentioned before, Lori, that I thought was really interesting, and maybe just say a little bit more about that, which is you said the industry is pivoting towards simulation-based learning. And I would love to hear just a little bit more about that and tell our listeners a bit more about the pivot to simulation-based learning for this industry.
Yeah, so healthcare is actually kind of late to the game when it comes to simulation. Any kind of high-risk industry has been doing simulation for a long time. If you remember Sully Sullenberger, that's how he landed the plane in the Hudson. He had done it in simulation. And so those high-risk, low occurrence type events, that's a perfect example right there. It's not every day that you're going to need to land a plane in the Hudson, but you better be ready to do it when it comes. Healthcare is the same way, but they have to and want to manage those appropriately, and they want to feel like they can provide safe care in those situations. So it's not only for patient safety, but it's also, we know new nurses are very fearful. All of us, when we were new, are very fearful that we're not going to know what to do or we're going to do the wrong thing. And simulation allows that unlimited practice where they can really build confidence and competence where you're not endangering patients.
Awesome. And yes, over to you, Sydney. Let's get into it about becoming a nurse right now. And you had this great journey that we want to hear about. What started you on your pathway to becoming a nurse? If you want to tell us a little bit sort of like what the different learnings that you did at different times were, interesting uses of technology or places where you thought maybe something like Transfr would have been really helpful.
Well, I got my first degree in Wisconsin. It was in criminal justice and psychology. So I originally did not go to school for nursing and had a few kind of random career choices after that. But my dad actually getting sick back in 2018 kind of led me to the path of nursing. It was more of, I realized I never want to be in a position again where I don't know what's going on with his health and don't know what questions to ask and all that. So it was more of a passion-led thing. So I applied to IUPUI in Indianapolis, and they were able to transfer a lot of my credits over, which was very helpful, but there were still a few courses I needed to take. And after completing those, I applied to the nursing program and thankfully got accepted the first time around. I know that is not the case for everyone. It can be very competitive because there are only so many slots available. And that was a 16-month program, which led me to graduation in May of 2022. So that was kind of the pathway to nursing, so to speak. As far as throughout school, we definitely did not have like virtual reality anything. There is one time where we did an online training where I think we missed a clinical day due to snow. This is the Midwest. So we did an online kind of step-by-step, what would you do with this patient? What fluids would you hang? Et cetera. I found that to actually be incredibly helpful. And I imagine that's similar-ish to what a VR experience might offer. Sometimes it's great to be in the hospital doing hands-on things, but a lot of times the nursing staff is very short at the hospitals. And the amount of time that I'm actually able to do hands-on activities while in school was somewhat limited because they're very time constrained. So doing a sort of virtual reality would have been great because for me, repetition is huge. I mean, that's how anyone gets stuff is by doing it over and over and over again. And especially with those rare scenarios that you're not even going to see whether you're in nursing school or an orientation, but you're going to encounter at some point, most likely, you want to know what to do. So something like that would have been great.
What do you think some of the benefits would be to having this kind of voice in your head guiding you through these things over and over again that's giving you direct guidance and feedback as you do the activity? Do you think having that sort of unlimited time to have repeats with these simulated patients would have helped you in your whole process?
Yeah, absolutely. I think some sort of VR training would have been helpful with, if it's sort of a scenario where like, what do you do next given all of this information, then you get to choose what you would do. And rather than a patient suffering the consequences of your decision, you can have somebody, point out, okay, well, we wouldn't want to do that because XYZ, this is why this is the correct answer. And, making mistakes like that in a virtual reality setting rather than with a patient, well, either one would stick with you, but like, let's choose the one that's not going to harm someone, right? So that would have been incredibly helpful, not to mention, this would be great in a nursing school setting, but also throughout orientation or even just like a yearly reminder of how to handle things because you don't encounter every situation on a regular basis. So regular practice, even for those who've been doing this 5, 10, 15 years, would be super beneficial.
Yeah, Lori's, your thoughts?
Well, I was just going to say, even though donning and doffing PPE is kind of a, basic skill, what we found during the pandemic was, a lot of nurses who were like, yeah, I know how to do that. But it wasn't something that they did every day, especially in areas that didn't typically take care of infected patients that were clean units. And they're like, no, I know how to do that. And then you would watch them do it and you're like, you're contaminating yourself all over the place because it's not something that they routinely do. But yeah, I think for Lori Hodges, she's managed nursing in all kinds of places, how you have found simulation with orientation and onboarding and competencies and all of that.
Yeah, so most recently we've adopted that practice. Some of it is because of accreditation issues. So it's not even, certainly the Joint Commission and the State Department of Health recognize that simulation should be part of the ongoing education and ongoing collaboration with your entire healthcare team. So some of it has been put in place because of those reasons. And we have found that that has helped and improved the workflow and improved just saving time and minutes for people's lives is huge. And if we can incorporate more simulation into that to help with that, that alone is worth it, because the time that we save, because we are better equipped to handle the situation, because we can open the package of the equipment that we're using, that matters. It saves minutes, it matters. So that's really important. And you don't always get the experiences. Unfortunately, some nurses every day they go to work, they have an emergency, but then a lot of us don't. So I think, unfortunately, hospitals kind of do an old school way of orientation, and then, they just put people through like the common check you off on certain things that don't even pertain to the day to day. So there's definitely a lack of innovation, of thinking about the best way to onboard. And I think that the best hospitals are incorporating the simulation exercises in orientation, but then after orientation, annual simulations. But really, we need to do monthly and quarterly, because that also would really help as well. So it can't just be, when we onboard and then 5 years goes by and, we're not using that skill. It's like anything. If we're going to spend the time to educate people on something, then they have to be able to apply the education, or it's not worth doing. So that's where the simulation comes into play. And I think hospitals are now really stepping up their game with that.
Okay, that's a great place to wrap up part 1. We hope you enjoyed it as much as we did, and we look forward to you joining us for part 2, right here on Upward with Transfr.